Hi, good morning Russell. My name is Callie Kinsey. I'm your invigilator for the OET speaking session on the 27th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Russell George.
And what is your candidate number, please?
My candidate number is 2650827.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Okay. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you do if you don't have an answer to a patient's inquiry?
I don't make guesses or assume if I don't know anything. I will ask a more experienced person or inform my nursing supervisor. I don't allow my lack of understanding of a concept to affect the quality of patient treatment. If anything sounds unfamiliar, I do quick research to learn about it. It could be on prognosis, signs, and symptoms, or medication side effects. If I'm still unsure, I speak with a provider or a superior. Sometimes, I ring the pharmacist if I have questions about some medications.
Tell us a little bit about yourself.
I graduated from nursing school in 2010. I pursued nursing because I truly love helping people, from advocating for them and being the hand they hold when they are scared to providing quality care and understanding the disease process. I'm a very motivated person and eager to learn in order to become the best nurse I can be. I am also very teamwork oriented. I believe that teamwork is so important in the workforce, but I am also someone who can work independently and know when to ask for help.
How would you de-escalate a situation with an angry patient who is not pleased with the care you are providing?
I had a patient who was unhappy with the long wait she was experiencing in the emergency room. She was upset, screaming, and was having a negative experience. I listened to her and apologized for the long wait. I explained to her that, unfortunately, it was a very busy day in the ER, however, I understood she was upset. I also assured her that her care and needs are of utmost importance to us, and as soon as the doctors get to her, they will provide that same quality care as they are to each patient. I explained the next steps, and she seemed much calmer to be in the know. I made sure to also offer some water and a blanket and provided her with my phone extension in case she needed anything else.
What would you do if you were unsure of a task or assignment you had?
If I was ever unsure of a task or assignment, I would ask one of my colleagues for help or speak to my charge nurse about it. I would ask if they can assist me or teach me so that I can know and feel more comfortable in the future, and hopefully, one day, I can be that resource for someone. If there was no one I could ask at that time, I would definitely search for other resources, as well, such as educational applications, or maybe another department that would know about this task, but I would definitely ask for help or guidance.
How would you handle a situation where a doctor places an order you do not feel comfortable carrying out?
If I didn't agree with an order a physician placed, and I knew it was jeopardizing patient care and safety, I would speak to the physician and ask for clarification. I would explain and give related information as to why I am questioning it. If after speaking to the physician, I still feel uncomfortable, and the physician refuses to change the order, I would reach out to my charge nurse, explain the situation, and seek further guidance.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good morning. My name is Russell George, one of the nurses working in this facility. Can you please tell me your full name for the confirmation?
Good morning, Russell. My full name is Callie Kinsey.
Hi, Callie. How are you?
I am good. Thank you for asking. How about you, Russell?
I am doing great. Thank you. For verification, please tell me the reason for your hospital admission.
Sure, I am admitted for hernia repair surgery.
Thank you for the verification, Callie.
No worries.
Callie, I am here to carry out preoperative checks on you, which has been informed during the earlier visits.
Yes, I got it.
Well, Callie, did you comply with preparation instructions?
Yes, nurse, of course. I have followed all the preparation instructions. But nurse, I am feeling a bit thirsty now. So, I would like to drink some water.
I can understand your feeling, Callie. However, it is essential that you need to be nil by mouth before the procedure. That is, no food for 6 hours, and no fluids for 2 hours, prior to the procedure.
I have followed the same. But now, I feel as if my throat is dry and thirsty.
It is quite natural, Callie. For your understanding, I will explain why you cannot take fluid through the mouth. The main reason is to avoid the risk of vomiting under anesthetic.
Oh, I see. Nurse, now it is clear why I can't have a drink so close to the operation.
That's great, Callie. Proceeding further, I need to do your clinical observations ahead of the procedure. Shall I proceed?
Yes, you may please.
Did you have any recent illnesses?
No, I haven't had any health problems recently, and I have been feeling fine.
Good to hear that, Callie. Moving further, I will explain pre-procedure steps and the pre-clinical observation steps to you.
All right.
First, you have to wear hospital garments. That is, you have to change the clothes and wear a hospital gown, followed by compression socks and non-slip slippers.
Okay. That's fine.
Thereafter, you have to take off your valuable wearings, jewelry, watch, and so on.
Actually, nurse, I wish to keep my watch on, so I can check the time when I wake up.
Your thoughts are quite sensible. I can help you understand the reasons for the removal of all jewelry. During the procedure, there is a higher possible need for electric current to seal blood vessels. Hence, there is a rise in the risk of burns due to metal jewelry. In order to prevent such accidents, I request you to remove the jewelry.
Thank you for the information. I will take off my watch as you instructed.
Good to hear that. Afterwards, you will undergo a medical examination. The doctor checks your personal medical details and possible observations that have to be done ahead of the operation.
Okay.
The final step to proceed with the surgery is to get your consent. We will give you the necessary information about the surgery for your knowledge, so as to get your consent for the procedure. I hope the steps are clear for you.
Yes, nurse.
Well, Callie, before that, I would like to know about your post-operative arrangements.
Nurse, I was about to ask that. Because my sister will be coming to pick me up after the operation, so I need to tell her what time to get me from here.
I am really sorry, Callie. The exact time scale for the discharge cannot be assured. That is just because there are several factors to be considered before the discharge process. For your better knowledge, I will tell you the discharge requirements.
All right, you may please.
Initially, your vital signs have to be stable. Along with that, your ability to tolerate food and fluid will be considered. Above all, you have to pass the urine to provide the discharge. These measures shows your readiness for the discharge.
Oh, really? Then I will just give my sister a call after the operation.
That's perfect. By the way, Callie, at present, I need your consent to proceed with the clinical observations.
Sure, I am ready to begin the preoperative checks. You may continue.
Thank you for your consent, Callie.
All right. That's great. That is the end of your OHE speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.